Gentlemen, please welcome CNBC's Maria Bartiromo.
Good morning, everyone. Great to be with you today. As we've heard this morning from Pete Peterson and Michael Peterson and, of course, President Clinton, addressing America's long-term debt is one of the most difficult and most important issues facing policymakers today. In this session right now, we speak with two of the leading Washington authorities on economic policy, Congressman Paul Ryan, the chairman of the House Budget Committee, and Gene Sperling, the director of President Obama's National Economic Council. And before I bring Chairman Ryan out, last month, the chairman introduced a proposal to reduce long-term deficits without raising taxes. The plan proposed significant changes to the Medicare program, Medicaid, as well as other cuts in federal spending. Some people have hailed the program as quite positive, others have criticized it. Let me bring on Mr. Ryan as he soldiers on, and he will talk to us about that plan. Congressman Ryan.
Thank you. Sorry, I got caught up with President Clinton.
Yeah, I saw that. Congressman Ryan, we're great to have you today, and we will talk with you about your plan, and then, of course, get Gene Sperling's comments on the White House plan. So your plan to cut deficits includes cutting spending by $5.8 trillion. You do not accept any tax increases on the revenue side, reducing budget deficits by $1.6 trillion.
4.4 over the 10 years.
Over the 10 years, that is included not increasing any extra revenue from tax increases, which is from Gene Sperling's plan. The proposal calls for fundamental restructuring of Medicaid and Medicare. So let's start right there. Can you walk us through what Medicare and Medicaid changes look like over this 10-year period and beyond?
Well, so over the 10-year period, no changes to Medicare. Medicaid over the 10-year period, what we're doing is basically taking a page out of the successful welfare reform policies of the 1990s that President Clinton signed into law, and we're sort of replicating those strategies to other parts of law, Medicaid in particular. With Medicaid, we're proposing to block grant the program back to the states and grow the program at a more sustainable rate. Medicaid's broken. Throwing more money at a broken system we've proven doesn't work. So we grow it at population plus inflation, population growth plus inflation. But more importantly, from talking to dozens of governors, we're giving them the freedom and the flexibility to customize Medicaid to meet the needs of their particular populations. In Wisconsin, we think we have a better way of doing it than, say, maybe New York or Nevada. And so we want to empower the states with the ability, because they already manage the program, but they get a lot of federal strings. We have successful programs that take years of getting waivers, block granting to the states, and let them customize it to meet the needs of their particular populations. Now, Medicare, we propose, and this is a little lost in some of the TV ads you hear these days, we propose to not change the benefits for people above the age of 55. More to the point, unlike the president's health care law, which takes $500 billion from Medicare, not to extend its solvency, but to spend it on the president's health care law, they also have a board called the IPAB, which is designed to sort of impact price controls. We repeal that board because that affects current seniors. We've recently heard some startling announcements from the actuaries at Medicare and what that would actually end up doing. We get rid of that. We make sure that any money coming from Medicare goes to saving and making it solvent. And we say for people 54 and below, because grant you, CBO is telling us Medicare is going insolvent in 9 years. The trustees moved up by 5 years, the date at which it goes insolvent. It's collapsing. And in order to keep the promise to current seniors, people in and near retirement, who've organized their lives around this program, you have to reform it for the next generation. So for those of us who are below 54, we say, move it toward a premium support system. That's the same kind of system that President Clinton's Bipartisan Commission to Save Medicare recommended. It's an idea that has had lots of bipartisan support in the past, and it would work like this. Medicare will go out and negotiate with insurers and have guaranteed coverage options from which then seniors will choose from. Medicare will subsidize their premiums, and it would do it like this. More for the poor, more for the sick and the middle income person than for the wealthy person. Less subsidy for a wealthy person and more for those who have less money. Doing it that way, harnessing the power of choice and competition, and subsidizing those with less with more and subsidizing those with more with less, makes Medicare solvent, makes it secure, and gives us the ability to keep the program as it's currently designed for those who are in retirement and 10 years away from retiring.
We want to talk about health care as well as the other areas that require delving into, such as defense spending and tax reform and other federal spending cuts that you've proposed. But let's stay on health care because I have a follow-up on seniors. The CBO says that your health plan would increase total health spending for a typical 65-year-old Medicare beneficiary by 30 to 40% in 2030. Because the private plans that replace Medicare under your plan would have higher administrative costs and less negotiating leverage with providers than the current Medicare program does. Why do you think that shifting Medicare beneficiaries to a fragmented system of private payers would reduce total cost?
Because experience shows us that it's working. I would disagree with the premise of that question, number one. Number two, measuring any Medicare reform plan against the status quo is to measure against a fiscal fantasy. We have tens of trillions of dollars of unfunded liability with Medicare. It's growing at an unsustainable rate, which is ultimately the biggest driver of our debt. Even President Obama acknowledges that with his cap on growth rate of Medicare using the IPAB, we do it a different way. But more to the point is we have experience. Medicare was written in 1965. It pays for brain surgery. It basically is a price controlling kind of a system that dictates the kinds of prices for bedpans and brain surgery. That's what John Bro always likes to say. The point we're saying is use choice and competition and have these plans compete against each other for the beneficiary's business in the future. Okay, where do we have experience with this? This is how the federal employee plan works. This is exactly how the Medicare drug benefit plan works. So we're saying move it to a system that works like the drug benefit plan. And what is the evidence? What is time and reality shown us? This is a plan that came in 41% below cost projections. So Medicare drug benefits, which work this way that we're proposing, cost 41% less than we originally thought it would because of choice and competition. It's very popular, and here's the key. It's the senior who gets to choose. And if she doesn't like the plan she has this year, she can fire that plan and go to another plan next year, and they know that, so they have to compete against each other on quality, on price. And using those market-based principles of choice and competition, where the power comes to the senior, not to a government bureaucracy, helps us improve this system and lower costs. Now, monopolies don't work, I would say, whether it's an insurance monopoly or a government monopoly. We want to break that up and put the power in the hands of the person, not in some 15 unelected bureaucrats to determine how this very complicated sector of our economy works.
How do we know that doctors and hospitals will be willing to treat Medicare patients under your plan if their reimbursements are lower?
So take a look at the current status quo. The trustees just gave us a new report saying that they believe about 40% of Medicare providers will stop taking Medicare patients under the status quo, under the current path we are on. Under the president's plan, they think more providers will stop taking patients because of price controlling. Medicaid is a problem in the same vein, where providers are taking less and less Medicaid patients because of under reimbursements. Under the program we're talking about, we're not saying price control, we're saying choice and competition. So providers are incentivized and rewarded for actually excelling and innovating and creating a better service at a lower cost. We want to have the patient-doctor relationship be the driver and the nucleus of the healthcare system, not a government price control system. And so I would argue that providers are going to be under more stress and more strain under a price-controlled system than under a market-based system where the power really goes to the person to select among competing providers for their benefits.
I want to move on to tax reform and Social Security, but one more question on the Medicare plan. The CBO says that your Medicare plan could more than double seniors' out-of-pocket costs. Is it realistic to assume that most seniors would be able to afford those cost increases?
A couple of things on that analysis. Number one, it fails to take into consideration the extra $7,800 we're talking about adding to low-income seniors' benefits. So what we're saying is protect those who are low income by supplementing their benefits and covering their out-of-pocket costs. We're also saying as people get sicker, increase their payments to stabilize their premiums. And as people get wealthier, don't subsidize them as much. So it's really inaccurate to suggest that that's going to happen to everybody. But the other thing I would say is it's comparing Medicare to a fiscal fantasy, which is the current system is unsustainable and it's growing at rates that are unsustainable that will crash the system. And so the question is, what are the kinds of reforms we're putting in place to get at the root cause of health inflation, to make our healthcare dollars stretch farther, to inject competition into the system so we can stretch our dollar farther, and then subsidize people more who need it more and not those who need it less. And so it's really kind of an incomplete comparison to suggest that that's happening to everybody. Yes, wealthier people are going to pay more in the future, but more importantly, there's only so much money to go around. It's finite. And what we believe we should do is save Medicare so it's something that the next generation can count on and subsidize people who need it the most and not as much people who need it the least.
We have questions from the audience as well as from Twitter on this particular part of the plan. But let me ask you about tax reform. We just heard President Clinton talk about the fact that it is very difficult to see how this plan would work without any new revenue. You are against raising taxes, and some people say that's really an ideology.
Yeah. That
you are just against any tax increase. How will this work without increasing revenue?
I wouldn't call it ideology, I'd just call it economics. And here's the missing ingredient in this conversation. If we allow this debt conversation to be one of mathematics and green eye shade, the missing ingredient is economic growth, is job creation. The two basic things we're trying to accomplish here are spending cuts and reforms and economic growth. Under the president's plan, the top tax rate on individuals goes to 44.8%. We don't agree with that. We don't think we should be raising tax rates. We don't think we should be taxing our employers and our job creators more than our foreign competitors tax theirs. And so we're not actually talking about cutting tax revenues, we're talking about tax reform. Just like the Fiscal Commission recommended. Broaden the tax base, lower the tax rates so we have a more flatter, fair, more internationally competitive tax system with an eye on economic growth. Do we want more revenues coming in to help close our fiscal gap? Of course we do. The way in which we think the best way to go after that is economic growth and job creation. Cranking up tax rates, I don't think is going to accomplish that. It's actually going to be counterproductive because I believe in this era of global competition, it's going to make our economy much less competitive. Most of the jobs, at least where I come from successful small businesses who file their taxes as individuals, as sub-S corporations, partnerships, LLCs. When you're bringing their tax rate, along with their state taxes, above 50%, that's going to put a chilling effect on hiring and job creation. On the corporate side, we have the highest tax rate in the industrialized world. The average industrialized world tax rate is 25%. Ours is at 35%. Some companies have a very low effective tax rate. Some companies have a really high one. We're saying clear out the clutter, all the tax expenditures, lower the tax rates on everybody so it's more internationally competitive with an eye toward job creation. And so under the guise that we're talking about, the person and the business that make the same amount of income should basically pay the same tax rate. That's not the system we have today. We need to clean it up with an eye toward economic growth, and with economic growth, you get better revenue growth.